What if the way you sleep tonight could silently raise your risk of a stroke before morning? It may sound alarming, but cardiac specialists are now cautioning that one widely practiced sleeping position is gradually restricting oxygen flow to the brain, increasing blood thickness, and elevating stroke risk by nearly 70%. What makes this particularly concerning is that millions of older adults are doing it right now, without any awareness of the danger. This video is not meant to cause fear. It is meant to provide clarity. After 15 years of working with older adults on their health and recovery, Dr. Thomas has seen the difference between those who act on this information and those who dismiss it. The changes that follow a single adjustment to sleep habits can be genuinely remarkable. Stay for the next few minutes, because what you are about to learn carries real, practical importance for your health. Before moving forward, consider this. Have you ever woken up with a numb arm, a stiff neck, or a brief episode of dizziness that made you reach for the wall? If so, share that in the comments. Dr. Thomas reads every comment and responds to help with individual situations. Dr. Thomas's channel exists to offer honest, grounded information about aging and long-term health. It is a space where questions are welcomed and no one navigates these concerns alone. If you have not yet subscribed, consider doing so, not as a formality, but because consistent, reliable health guidance genuinely matters as we age. The viewers who engage regularly, who ask questions and apply what they learn, tend to report better outcomes. You deserve access to that same support. Now, let us address what is actually happening in your body while you sleep. Most people assume sleep is a passive state. You lie down, your body rests, and you wake up refreshed. That assumption is incomplete, and for older adults, it can be a costly one. During sleep, your body is performing a series of demanding physiological tasks. Your heart is continuously pumping blood upward to your brain. Your lungs are working to oxygenate every cell in your body. Your spine is decompressing after hours of bearing your body's weight throughout the day. The position in which you sleep directly influences how successfully your body completes each of these processes. For adults over 60, this is no longer simply a matter of comfort. Arterial walls narrow with age, blood can thicken, the cardiovascular system works harder overall. In this context, the wrong sleeping position is not just inconvenient. It can contribute to a medical emergency. Consider the case of Juliet, a 73-year-old retired librarian from Pennsylvania who had been sleeping face down for 5 decades. Each night, her head was turned sharply to one side for 7 to 8 hours. She believed it helped with her back discomfort. What she did not realize was the effect this was having on her circulation. Stomach sleeping, particularly after the age of 60, forces the head into an unnatural rotation just to maintain an open airway. This sustained rotation compresses the vertebral arteries, which are the primary blood vessels running through the neck that supply the brain. Research published in the Journal of Stroke and Cerebrovascular Diseases indicates that prolonged neck rotation during sleep can reduce cerebral blood flow by up to 40%. The consequences of that reduction compound over time. Stomach sleeping also flattens the natural curve of the spine, compresses the lungs, and restricts breathing depth. Shallower breathing means lower blood oxygen levels. To compensate, the heart increases its output. Sustained over months and years, this pattern contributes to elevated blood pressure, increased blood viscosity, and a greater likelihood of clot formation. Physicians who specialize in cardiac surgery refer to this as the silent stroke position, precisely because the cumulative damage often goes unnoticed until a clinical event occurs. For Juliet, that event came on a Tuesday morning. She experienced dizziness upon waking, tingling in her left arm, and mild difficulty forming words. At the hospital, she was diagnosed with a transient ischemic attack, commonly referred to as a mini-stroke. The neurologist's first question was about her sleep position. Upon hearing her answer, he explained that decades of nightly compression had been gradually compromising blood flow to her brain. If you are a habitual stomach sleeper, this is not a judgment. It is an honest, evidence-based caution. The habit feels comfortable because it has been practiced for years, possibly decades. But the physiology does not accommodate it as well after 60 as it did at 30. Trying an alternative position, even gradually, is a reasonable and potentially significant step. Have you noticed morning numbness, tingling, or dizziness? Share your experience in the comments. Dr. Thomas reads every response personally, and your account may also be relevant to someone else watching. Now consider a second position that is often assumed to be safe, but carries its own risks: sleeping flat on the back with minimal pillow support. For many years, back sleeping was widely endorsed by medical professionals as the most anatomically neutral option. For younger adults with good muscle tone and healthy airways, that recommendation has merit. For adults over 70, the picture is more complicated. Raymond, a 76-year-old retired police officer from Texas, had slept in a rigid, flat position his entire adult life. He considered it disciplined and posturally sound. What he was not aware of was the way gravity was working against him each night. When a person lies completely flat, particularly if they carry additional weight around the midsection or have any weakening of the throat muscles, the tongue and soft palate can fall backward, partially obstructing the airway. This is the physiological basis of obstructive sleep apnea. According to the American Heart Association, untreated sleep apnea increases stroke risk by 300%. Each interruption in breathing causes oxygen levels to drop, the brain to signal distress, heart rate to accelerate, and blood pressure to spike. Repeated across hundreds of nights, this pattern damages the small blood vessels supplying the brain. Flat back sleeping also creates conditions favorable to acid reflux. When the head is level with the stomach, digestive acid can migrate upward into the esophagus. In older adults, chronic acid exposure can irritate the vagus nerve, which regulates heart rhythm. Research links untreated reflux to meaningfully elevated rates of atrial fibrillation, an arrhythmia that significantly raises stroke risk. Raymond's situation was identified before a stroke occurred, but only because his wife observed something alarming during the night. She noticed he was repeatedly stopping breathing, each episode followed by a gasping recovery. She recorded it and brought it to his physician. A subsequent sleep study confirmed severe obstructive sleep apnea, 68 breathing interruptions per hour, with oxygen saturation dropping into clinically dangerous ranges. His cardiologist was direct. The risk of a major stroke was immediate and serious. The intervention prescribed was not a new medication. It was a change in sleep position and setup. That outcome reflects an important principle. Some of the most consequential adjustments to long-term health are behavioral, not pharmaceutical. The bedroom, and specifically how a person is positioned in it for 7 or 8 hours each night, is a legitimate clinical variable. Given that stomach sleeping compresses the vertebral arteries and flat back sleeping can obstruct the airway and elevate stroke risk, the logical question is what positions are actually recommended. There are 3 that cardiac specialists consistently endorse, and none of them require specialized equipment or significant expense. They do require consistency and a willingness to adjust an established habit. Before those are outlined, one request: if this information has been useful so far, engage with it. Leave a comment, ask a question, share a concern. Dr. Thomas reads every comment personally, and the guidance provided is most effective when it is responsive to the specific situations viewers are facing. The first and most clinically supported position is left-side sleeping with proper structural support. This is not simply sleeping on either side. The specifics matter. The head should rest on a pillow that keeps the neck aligned horizontally with the spine. A second pillow should be placed between the knees. These details are not optional refinements. They are what separate effective side sleeping from a position that merely shifts one set of problems for another. The left side orientation is recommended for a reason rooted in anatomy. The heart sits slightly to the left of center in the chest cavity. When the body is positioned on the left side, gravity supports the return of blood to the heart rather than working against it. Research published in the Journal of Clinical Gastroenterology indicates that left-side sleeping reduces acid reflux episodes by approximately 80%, a consequence of the stomach's anatomical position relative to the esophagus in that orientation. Reduced reflux means less irritation to the vagus nerve and, in turn, more consistent heart rhythm. The pillow between the knees addresses a mechanical problem. Without it, the weight of the upper leg pulls the pelvis into a slight rotation, which progressively misaligns the lower spine and restricts circulation to the lower limbs. With it, the hips remain stacked and the spine stays neutral throughout the night. Caroline, a 68-year-old former nurse from Michigan, had been managing elevated blood pressure and persistent morning headaches for 3 years, despite increasing medication. A conversation with Dr. Thomas about her sleep habits revealed she was sleeping curled tightly on her right side. A single positional change, left side sleeping with knee support and proper head alignment, produced measurable results within weeks. Her blood pressure moved from 150/95 to 130/80. Her cardiologist reduced her prescription. The second recommended position is sleeping with the upper body elevated at an angle between 30 and 45 degrees. This is particularly relevant for individuals managing sleep apnea, acid reflux, or congestive heart failure, though its benefits extend more broadly. When the head and chest are elevated, the airway geometry changes in a meaningful way. The tongue and soft palate are less likely to shift backward. Breathing remains more consistent and unobstructed throughout the night. According to the Sleep Foundation, elevating the head of the bed by 6 to 8 inches can reduce sleep apnea episodes by approximately 60%. Beyond airway support, elevation reduces the workload placed on the heart during sleep. In a flat position, the heart must pump blood upward against gravity to supply the brain. In an elevated position, that gradient is reduced. The result is lower nocturnal blood pressure, reduced vascular inflammation, and a decreased likelihood of clot formation. Achieving this does not require a specialized adjustable bed. A foam wedge pillow, a set of firm stacked pillows, or blocks placed under the legs at the head of the bed are all practical options. What matters most is that the elevation is maintained consistently every night. Vincent, a 72-year-old retired firefighter from Oregon, made this adjustment following his second transient ischemic attack. Dr. Thomas notes that his cardiologist had identified sustained nocturnal strain on his heart as a key concern. After 2 months of consistent elevated sleeping, Vincent's cardiac ejection fraction improved from 35% to 48%, a clinically significant change achieved without altering his medication. The third position draws on the strengths of both previous recommendations, left side sleeping combined with upper body elevation. In this arrangement, the body is oriented on the left side, while the head and chest are propped higher than the legs. This is closely related to the recovery position used in hospital settings following stroke, because it simultaneously optimizes cerebral blood flow and maintains an open airway. Setting this up requires 3 pillows. A firm pillow under the head, positioned so the neck remains straight and unstrained. A wedge or stacked pillows placed behind the back to prevent rolling onto the spine during sleep. And a pillow between the knees to preserve hip and spinal alignment. It requires more preparation than a standard sleep setup, but the physiological rationale behind it is well established. Beatrice, a 79-year-old stroke survivor, was instructed to adopt this position by her neurologist following her initial event. She maintained it consistently for 1 year. Her follow-up neurological imaging showed no new damage. Her carotid arteries, which had displayed significant narrowing, showed marginal improvement. Her physician's assessment was straightforward. Whatever she was doing was working, and she should continue. What Beatrice was doing was giving her body the conditions it needed to recover rather than to strain. Consider which of these 3 positions is most applicable to your situation and try it tonight. If you have questions about adapting any of them to a specific health condition or physical limitation, leave that in the comments. Dr. Thomas responds personally to provide specific practical guidance for each situation. The central message of everything covered in this video is straightforward. The choices made during sleep are not passive. They are active determinants of cardiovascular health, particularly as the body ages. Genetics and time are outside our control. Sleep position is not.